we are very excited to share this new initiative with you all. I will introduce our speaker in a couple of minutes, and there will be a Q&A at the end. First, my name is Jishal. I am the Network and Development Manager here at Hint. A big part of my role is to introduce DPCs to employers, TPAs, and benefit advisors to facilitate growth in our community. Here is a quick preview of our agenda. Dr. Cameron will take you through Hint Connect's inception and benefits, and I will walk you through the highlighted features that we know our providers enjoy, as well as how to join if you are interested. So without further ado, I am delighted to introduce Dr. Cameron, the President and CEO of Hint Connect. Dr. Cameron received his medical degree from University of Washington School of Medicine and has 20+ years of experience practicing family medicine. Over the last decade, Dr. Cameron has been a passionate advocate and for the need of revolutionized primary care in his role as a DPC physician, medical director, and medical group president. He is well respected in the DPC community, adored by his patients, and eager to bring nationwide access to affordable care for all. We are lucky to have him as our champion for Hint Connect. Next, we have Beth Holmes, also on the webinar, our fearless leader for network development here at Hint Health. She comes from a robust background of provider contracting, performance management, and consumer innovation. Having spent many years in the insurance managed care space, Beth wholeheartedly believes in the DPC mission and is excited to help power Hint and direct care to make it the new standard. With that, Dr. Cameron, I will turn it over to you.
Great. Thanks, G. Yeah, I wanted to start off a little bit about the why, about what we're trying to accomplish. And for me, this started way back, right after residency. I was trying to figure out after residency, what kind of job did I want to do? And I was in Tacoma, Washington at the time. And at that point, there were really two main options. I could either join one of the two hospital systems, or I could join a community healthcare system. And I was idealistic, wanted to make an impact. And so I joined the community health system. And I was there for 10 years. I loved it. I loved the mission, my patients. I felt like I was making a difference, taking care of people that would be going to the emergency room if they weren't going to the community health center. The problem is the way the system was set up is I had 15-minute visits with really complicated patients, many of which were uninsured. This was before the ACA, and many didn't speak English. I loved the mission. I loved what it was doing, but it was sucking the life out of me. I was talking to my wife. I'm like, I don't think I can do this for my whole career. And I didn't know what I was going to do. I felt stuck. I didn't want to go work at a health system, but I wasn't sure how much longer I was going to keep living like this. And I was trying to think like, okay, am I going to stay in medicine? But it was in 2011, I went to our county medical conference meeting. And one of the speakers was Garrison Bliss. And he gave a talk on direct primary care because he was up in Seattle. And he was talking about how healthcare insurance should be much more like the auto insurance industry, where you don't use insurance to pay for gas and oil changes. It's mainly for car accidents. And also he talked about how he didn't have to fight insurance companies to be able to spend more time with his patients or to talk about obesity because it might not be covered by insurance. And I knew after that one talk that that's what I wanted to do. And so later that year, I made plans and I made the switch to direct primary care. I finally did, and I will never go back. I love direct primary care. My patients love the experience. As you all know, there's cost savings for my patients, for employers. I get more time with my patients. And I feel like I can actually practice medicine the way that I wanted to practice medicine. And I know I'm speaking to you all that feel the same way. But I also chatted with a number of my colleagues that were still in fee for service. And I talked to them about DPC, but there's a lot of hurdles that I found about why people did not want to go into direct primary care. And I think there was just a lot of fear. One is that it's trading the financial stability for, even though they may not like their job, they've got some financial stability, especially for people that had families, kids that were in college, and to potentially go into the unknown and do something different where financially they may not be so certain about what that's like. Plus, also starting up and running a practice is daunting for a lot of people. There were questions like, will I be able to attract enough patients? How long before my business will be in the black? What will be my capital investment? I mean, how much money am I going to have to pour into this thing before I'm financially secure? Or some people are like, will I even make it? Will I have to shut down my practice because I'm never going to get it fully launched? And many of you have probably wrestled with these questions, or maybe you still are wrestling with some of these questions. But one of the things I want to talk about today is, are there some solutions to these obstacles? And we already know Hint Health is helping to support direct primary care practices with enrollment, with billing, with member services. And many of you use the Hint OS platform. Also, some DPC organizations hire physicians, nurse practitioners, and physician assistants, and that helps to mitigate some of the financial stress. But what I'd like to talk mostly today about is networks. And there's already a number of networks across the country where DPCs can join forces to be able to partner and to be able to take care of employees, dependents of larger employers. But one of the questions I've always wondered is, why is the United States taking so long to have mass adoption of direct primary care? What's taken so long? I mean, this is a great product. We all know that this is great for patients. It's great for companies. It's great for doctors, nurse practitioners, physician assistants. Well, one of the things, there was a employee benefit trend in 2020 and 2021 that indicated that employers are really thirsty for having new advanced primary care solutions. And as DPC practices, you're all familiar with the importance and the immense value that we offer to both employers and members. So why hasn't it received wider adoption? So if you take a look on the screen here, this is what employers have been telling brokers. So one, they say, is employers need a lot of help getting to know DPCs in their area. They just don't know where to go and learning more about So one thing I do know is that DPC is starting to percolate, and a lot of companies now are coming and saying, hey, we want DPC. They know about DPC, but still, there is still a number of companies that really don't know too much about DPC. So there's just an education gap. The second is just the tactical aspect of employers saying, how do I contract with multiple DPCs that have different prices, and how do we know what services they offer, and how do we send checks to 8 different physicians? And then another category is just the transparency, the desire to have a marketplace platform so that they can be able to see all these independent DPCs in one aggregate form. And then lastly, to be able to make it just simpler, to make it more automated and more efficient. I mean, they're busy, and I think that it's taxing for them. And then for those of you that are partnering with employers, how much time and effort it takes to partner with an employer, and the process is really slow. That sales cycle, where the time where you first have the first conversation with an employer to the time that they actually sign and get things off the ground, it can usually take 1 to 2 years. And so there's definitely some obstacles. So next slide, we'll talk about the solution. G, would you switch to the next slide for me? And so Hint Connect, the vision is that Hint Connect is going to provide a single point of access to hundreds of DPC community-based practices in order to unlock DPC for employers, because they are wanting to search for better primary care options. And Hint Connect is also going to enable individual DPC practices and networks to more easily expand their affiliations so that they can support large employers. And as a result, our advanced primary care model will become even more accessible to those that are forward-thinking patients, providers, employers, and benefit advisors. And so if you take a look here, Hint is already working with over 1,600 direct care locations, with over 2,800 DPC providers, with 40 plus networks and almost 6,000 employers. And so Hint Health is partnering by making a subsidiary company called Hint Connect, which is a professional corporation that can contract with employers and DPC practices. And so then together, using this, we can be able to help facilitate that connection. And so at this point, let's go to the next slide, G. What it looks like for the DPC practices is we want to put together a transparent marketplace so that DPC practices can set their own rates and say, hey, this is how many patients we would like to get from Hint Connect, from employers that Hint Connect is going to bring to us, so that you can decide, okay, you know, how much do we want to have, how many of our eggs do we want to have in one basket, so you don't have all of your patients from one place. And then also we want to try to help support your autonomy so that you can practice the way that you practice. You do not have to be on any one electronic medical record. This is a non-exclusive arrangement so that you can continue to partner with other networks, and you can partner with employers and retail patients directly. And how much does it cost for you to join? Nothing. So providers and provider-led networks participate for free. And the rate that you set, 100% of that goes to your practice. So we do have an administrative fee. It's a small percentage, which depending on the contract will be between $2 to $5 per member per month, and that will be charged directly to the employer. Hint Health will also partner with you to help with the contracting, to make it easier so that you can do what you do best, which is focusing on high quality care and taking care of patients. And then we've got a team, a network development team, which will educate employees on the benefits of direct primary care to help say, hey, this is how you enroll, and then help them to be able to engage with practices. Plus, the network will be a place where you can be partnered up with other mission-aligned providers in the community so that you can expand your affiliations, so that we can all support larger employers. And lastly, you don't have to be a part of the Hint OS software to be a part of this. And so overall, really our aim is to help support you and to build your practice, but really to fulfill the mission of spreading DPC so that this is the main way that primary care is delivered across the nation. So let's move on to the next slide, talk about geography. And so this is the Hint Connect expansion strategy. So we're actually currently in business here in Texas, and we've got licenses in Colorado, Arizona, Oklahoma, and Florida, and are opening up in those 4 states, and we'll be ready in the next 1 to 3 months in those areas. And so if you're interested, you can contact g@hint.com to learn some more. And if you're already working with an employer that perhaps has some geography outside of your area, and you think that, you know, potentially Hint Connect can help fill in some gaps in your geography, please let us know, and we'd love to partner with you. What I'd like to do now is to pass it to G, who is going to discuss the features of Hint Connect.
Thank you so much for that thorough overview, Dr. Cameron. I am now going to take you through a couple of our feature highlights. As we build out Hint Connect more in the near future, There'll be many more iterations and features designed to delight our providers and employers. We take our cues from all the stakeholders in the DPC community, so just know this is designed with all of you in mind. So one of our key goals for HINT Connect is to make sure our providers stand out in the marketplace, right? Our provider's profile page is designed to surface a myriad of pertinent information to ensure there's full transparency in this network. We help gather data, including provider bio, profile pictures, patient testimonials, specialty education, etc., from the provider's website during onboarding. Once the data is confirmed, we will ingest all of it into HintOS and curate a profile to attract employers. As you've heard from Dr. Cameron's overview, brokers and employers and the like have expressed a need for an Etsy-like platform where there's an aggregation of all the independent DPCs. This is where we are particularly proud of our ability to enable multifaceted provider search. If you ever accrued migraine from shopping for a provider on one of the Buca directories, right, myself included, you'll know it's incredibly challenging to narrow down provider search for more than one criteria at a time. We know the importance of being able to search DPC providers by their physical geography, their specialty, membership cost, and more. So this is a solution that we know employers will love. In addition to empowering their ability to self-serve, our dedicated team of network development and analytics will also conduct in-depth geoanalysis to help determine the best DPC match for our employer prior to benefit launch. We can provide detailed information down to the DPC market penetration per zip code of each employee. Last but not least, I want to call out that so many of us have heard the chicken and egg dilemma when it comes to growing DPC, right? Do we secure providers first without employers lined up? Or do we try to pitch to an employer with a long sales cycle of sometimes 2+ years and then try to find providers prior to implementation? There is no right answer here. And that's why we are helping sourcing demand in tandem with building supply. So problem solved. The last feature I'd like to take you through is an example of the beautiful integration of HINT Connect and HintOS, our core product at Hint Health, the leading provider of member management and billing system. At Hint, we want to take on the busy work so you don't have to. One way to ensure our providers have a seamless experience managing Hint Connect sponsor membership is to allocate a sponsor tab in their HintOS account so they can easily review member status, count, and account balance. These are just a few examples of Hint Connect features that we have many more on the roadmap. This includes exploration into how to measure and track member experience and satisfaction so our providers can finally quantify the tremendous value DPC brings to their patients. If you're wondering, how can you join if you're eligible? We have just a few simple requirements to make sure that you meet the core tenets of DPC. We fully support your autonomy when it comes to services you wish to provide, but at a minimum, we ask providers to provide medical services to include primary care, preventive care, acute care, chronic disease management, and coordination with specialist care. From a non-medical services standpoint, we want to make sure there is after-hours access, electronic communication access with our patients, no wait or minimum wait appointments, and same-day or next-day appointment. Last but not least, how do you join? There are 3 easy steps. The first step is to review the contract. If you are interested, please email me at g@hint.com. I can send you the contract for you to review. If you're interested and have questions, happy to jump on a call and clarify any questions you may have. Step 2, we execute the contract via HelloSign. It's very easy, and I will highlight all the sections that want your attention in order to execute the contract. And the last step is to complete the onboarding data collection piece. And I will then go ahead and affiliate your provider account with Hint Connect and make sure your profile is up and ready. All right, folks, I appreciate everyone for coming. If you'd like to be a part of Hint Connect, please feel free to reach out, and we are happy to meet with you or send over a contract for you to review.